proper recovery can make all the difference in how your healing goes and how you feel in the long term. If you had an abdominal surgery, say a C-section, a hysterectomy, any kind of surgery in the abdominal region, it can come with a lot of questions and a lot of questions more about the recovery and the healing phase and what you should or shouldn't do and a timeline for that. Well, my name is Dr. Dawn Andalone. I'm a women's health physical therapist, and I have helped so many women navigate that pre-surgery and post-surgery when it comes to anything to do with the midsection of your body and how to aid the healing and help your body recover smoother and faster, and also just give you the tools so you can help your body in the long run. Now, I know you may not get very much information after your surgery from your doctor. Usually things like don't lift more than 5 pounds, don't climb stairs, don't do anything too strenuous, don't drive right away. I hear all those things that women say, well, I was told not to do that, but what can I start doing? Or at what time can I start doing those things? So it does depend from woman to woman on your recovery, on your healing, and those phases of healing. But I want to say that every woman is going to recover and have a different experience. And so the more that you do know going into the surgery, the better you'll be prepared. Now, just know in those first 2 weeks, you are going to just want to rest and recover and take care of your body. Focus on nutrition, focus on really getting the higher protein foods in your diet, some warm soups, things that are going to aid in the healing, and just allow that body to go through that inflammatory process. Stay hydrated. And your body does need rest because the inflammatory process, your body's at work when you've had some trauma to the area, and you will feel better if you just give yourself that time to rest and recover and get some help in the beginning. So here's some of the main things to avoid. And number one is heavy lifting. So if you have a toddler, if you have a young child at home, make sure someone can come help you out. And so you're not having to lift a child into their bed or into their car seat and really doing any strenuous lifting with groceries, or just getting some help around the house is going to be very beneficial, because anytime you're putting strain or stress on that area, it can impact an incision that you have healing and create more pressure in that area that you don't want to have while you're in this healing phase. So I would say at least the first 2 weeks until you have your post-op appointment, you definitely want to avoid any heavy lifting. And this goes with any type of abdominal surgery. And then check in with your doctor at that mark, whether it's a week after, 10 days after, a few weeks after, to make sure that you are cleared because your incision has gone through that healing phase and you can gradually start lifting heavy. So you're not going to go from 0 to 50 pounds, but you may go from starting to integrate a little bit more daily activity. So if you were lifting a vacuum or you were lifting a gallon of milk, things like that around the house, and then see how you feel a couple hours later or the next day. And then you can gradually build on that. If you're someone that loves to lift weights, I get this question all the time, when can I start lifting again? Well, you want to make sure that you have a good foundation if you worked on some core exercises first before you start adding more resistance and more weights to your program of weight training. So if you're doing things around the house and you're getting extra sore, then you're probably not ready to do additional weight training. But if you're tolerating those activities around the house and you're feeling better and you're doing a lot of walking and moving at that point and you've been cleared by your doctor, then starting off with 5 to 10 pounds and then gradually building up from there too, alongside working with a lot of core and pelvic floor exercises that are going to help you focus on having this area of your body strong enough that you're not going to put more pressure on the area that had the surgery, and you can still promote healing in that phase too. You want to avoid any strenuous exercise. So this goes along with weight training, but strenuous meaning running, jumping, doing anything high intensity, because this also will put more pressure on the area that is healing. So whether you had a hysterectomy, you had a C-section, any of that, you really want to allow your body for a good 6 to 8 weeks to really recover and heal. And then once you're doing some more isolated exercises or sitting on an exercise bike, going for a walk, things like that, or swimming once you've been cleared with your incision, things like that that are going to be more cardiovascular and promote that feeling of getting more of, breaking a sweat and feeling better and boosting those endorphins without putting too much strain and stress on that area of your abdominal region. So this also, number 3, goes along with straining. So if you're having a bowel movement or you're experiencing a lot of constipation, that also straining this area is going to put more stress and pressure. And it's not going to help the incision if you are putting a lot of downward pressure on your pelvic floor when you are trying to go to the bathroom. So staying ahead and not having constipation by doing some things with increasing your fiber intake, helping promote things like a natural tea or things that you can find in the grocery store in a more natural way to boost that digestive tract, to push the fluids through and stay hydrated. All those things can help you with avoiding any constipation and having extra strain on that area. And then getting back to being intimate. So number 4 is returning to sexual intercourse. You will be putting more strain on that area as well. And so making sure that you're at least a few weeks to 6 weeks to 8 weeks out after surgery and you've been cleared by your doctor, but going back to exercise first before engaging in any intimacy and sexual intercourse is going to help you prepare, because you want to see how your body is under a little bit load and pressure before you be intimate with your partner, because that can also irritate the incision and cause more strain or pressure in that area. But visiting a pelvic floor physical therapist, they can definitely put you at ease and make you feel like you can check those boxes, like your body is ready by their assessment and their ability to tell how your pelvic floor muscles and your core muscles are functioning and if you're ready for that next step too. Then the next one is bathing and swimming. So having your incision fully healed, you've been cleared by your doctor, but sometimes they don't want you to submerge yourself and really have a lot of water in that area or any other ointments or creams on that area. So submerging in a bathtub or a hot tub or pool, you definitely want to make sure that's been cleared by your doctor before you do those things as well, because that can slow down the healing process too from an abdominal surgery. And then the last thing is you don't want to ignore pain. Pain is a red flag that your body is still undergoing some of this healing and the trauma to the area and it's not over it yet. So if you are experiencing pain, just dial it back a little bit. Your activity level is going to look very different, like I said, from another woman that has had the same surgery than you. So you have to take in consideration, it's just a warning sign to tell your body it needs to take a step back, chill out, rest, and then take more of those baby steps in order to return to exercise and return to more strenuous activity. And if you're really concerned about the pain that you're feeling, you definitely want to check in with your doctor and see if there are other ways that you can be able to calm some of that too. Sometimes putting a heating pad over your midsection abdominals, maybe wearing a brace or abdominal binder, other things that if you're getting back to activity and you're still experiencing some pain, it could be from the actual incision site. So if you're developing any scar tissue there, you want to go watch my video about doing scar tissue massage and mobilization, because this can really help that area heal as well. Once that incision is healed, after at least about 10 days, then you can go do some massage and soft tissue work in that area or visit a practitioner that can do that for you. And that can be very beneficial to help with the pain relief as well. So some other tips to help with this, I mentioned nutrition, I mentioned hydration and getting enough rest, but also paying attention to your posture. Posture has a lot to do with how you strain your midsection and also your back. So making sure when you're sitting that you are supported by having a back support against you, so you're not having to engage these muscles too much. And if they're tired or they're weak, it's getting back to the right types of really restorative and core related exercises to help your midsection too. I have a pelvic floor Pilates program that can be very beneficial once you are getting back into core exercises and you want some guidance of a Pilates routine that is safe to do, then and with modifications, then you can look at the description below, because I talk about that program too that can be really helpful for you with just 15 minutes a day of a movement sequence that a lot of women have found helpful for restoring their core and their pelvic floor muscles too. But staying hydrated, nutrition, rest, posture, and just listening to your body. I can't say that enough. Listening to your body and knowing what your body is telling you and really being in tune with that and not just pushing too hard as well. So I hope you found these tips helpful after an abdominal surgery. It is important to know what to expect in the case of having any pain or discomfort and how you can navigate that and be able to give yourself the best opportunity to heal and recover. And I hope this video was helpful for you. So thanks again for watching, and we'll see you again in another video.